Good morning to everyone. If you're just joining, please put your name and organization in the chat box. Just going to give a couple more minutes to let people jump on. I still see some people logging in here this morning. Good morning. For those of you just joining, please enter your name and organization into the chat box. And then also for those of you that are on, just know we are recording this meeting. We do post it to our Jackson County Health Department website after the meeting, as well as all the chat notes and action team reports. So we are recording this and it will be available on our website, Jackson County Health Department. So that's jchd.org. And so let's go ahead and get started this morning. So just a couple updates on my end. I sent an email out probably before the holidays, sometime early December, and then yesterday as well. I know it's kind of a difficult time of year, but next Friday, so the 26th, we're going to be holding an in-person special Jackson County Healthy Communities Coalition meeting. And really what that meeting is for, so that's going to be at the SIH corporate office, and it's from 10 to noon. And that meeting is really going to be setting our health priorities for our county health improvement plan. So every health department in the state of Illinois has to do a 5-year health improvement plan. And basically, as we've done in previous years, for those of you that don't know, typically we use this coalition to help set those priorities, and then basically I work with the action teams to set those strategies, and we'll kind of keep you in the loop as this goes along. We're not going to make that available over the phone. It's just going to be in person. And the reason we're doing that in person is because it's really hard to kind of engage with individuals and have a conversation through WebEx, as I think we've all kind of learned over the years. So we really want to make sure that we're good in getting the feedback from you all. And then also in those links or those emails that I sent, there's a survey as well. So if you have not completed that, please do so. If you can't attend next Friday, the 26th, that survey has kind of priority settings. So you can kind of set what your priorities or what's most important to you. And then also there's kind of open fields where you can enter in other information. So we're definitely getting your feedback regardless if you can attend that day or not. So we do appreciate it. Hope to see everyone there next Friday. So again, that's January 26th. So it's going to be 10 a.m. to noon, and it's going to be at the SIH corporate office. So that's kind of over in the Carbondale Mall area. And basically the entrance is on the east side. So don't go through the breast cancer side. It's on the other side of that building. And you do need to use I guess they have kind of an intercom system or else the doors are locked. So hopefully you guys can make it next Friday. So also new for this year, instead of every other month, we're going to a quarterly format. So this will be the first one for this year in 2024. Our next meeting is going to be Thursday, April 18th. And then we have July 18th and October 17th. So that kind of spaces it out. I've been requesting action team reports in kind of the interim when we're not meeting. We'll kind of see how that goes, if we're getting good responses or not. I know it's been difficult over the holidays with people traveling, vacations, things like that. So I'll continue to request those action team reports, and we'll just kind of see how that works going forward. So before we jump in, do we happen to have Carmelita or anyone from the Carbondale Warming Center on the call this morning? Okay, not hearing anyone. I think I saw Kitty Jewell. Are you on this morning?
I am on. I'm here.
Okay, we can hear you. So
okay.
Kitty, if you don't mind, I might pull up your presentation and let you go first. I'm sure the warming center with the weather that we've had, they're probably overwhelmed. So I'm not sure if she'll be joining us this morning, but we'll loop around back to her, and Kitty, we'll pull up your presentation for this morning.
That sounds good. Do you have it, right? Or do you want me to pull it up?
No, I've got the one here. Is everyone able to see that, hopefully?
Yes.
Okay. All right, Kitty, so when you're ready.
Might help if I start my camera. Can you see me?
Oh. Yes, I can see you.
Okay. Hi, everyone. My name is Kitty Jewell, and I am the director of the Center for Rural Health and Social Service Development. The center is located in Wheeler Hall. You see a picture of it there. And we're on the SIU Carbondale campus. The center serves as the outreach arm of I should say the rural health outreach arm of the SIU School of Medicine. Next slide. The center was founded in 1989 and was originally housed in the Department of Economic and Regional Development in Carbondale. It was an SIUC center, but then it moved in 2013 to the School of Medicine. And the mission is to strengthen the rural health infrastructure and promote opportunities for enhancing health in rural communities in Southern Illinois. The service area, though, has recently extended throughout Illinois, and our programs are being implemented statewide. Next slide. So we have 4 offices. We have the Southern office, which is in... Oh, can you hear me?
Yeah, we can still hear you. I don't think everyone's muted.
Okay. So the Southern office is in Wheeler Hall. We've got the Western office in Canton, Illinois. And only we have the Eastern office, and we have a new office in Dixon, Illinois, which is the very northern part of Illinois. Next slide. So here are our staff. We have 16 regular staff and 4 students working with us. And so we've grown considerably since I've been here. I came in 2017. And I think we had 8 staff at the time. And so, so the staff have grown and our programs have grown. Slide. So our primary objectives, although our programs have changed, from year to year, our mission and objectives have remained the same: to support development of public health infrastructure, support the enhancement of community programs through sharing of expertise or fundraising, and to provide educational opportunities for health and social work, the social work workforce. Next slide. So at the center, we focus on serving underrepresented and vulnerable communities, such as those in rural areas. We ensure that our programs and services align with the needs in each region, and that our programs help people attain healthy lives, as well as promote health equity and eliminate health disparities. Next slide. So we have a lot of projects here. Oh gosh, can you guys hear me?
Yeah, we can still hear you.
Okay, you can. Okay, good. So we have like a number of projects, and this isn't all of them. at this time. And when I came on, I think we had 5. And so these have developed under the leadership of Jeff Franklin, who's now our executive director. And what I'm going to do is highlight a few of the programs moving forward. And I know I have 10 minutes, and so I will stop, Matt, when you tell me to stop. So the next slide. Okay, the first one is the Certified Recovery Support Specialist Training and Apprenticeship Program and the CRSS Success. These are 2 separate programs, but we're kind of trying to bring them together. The CRSS Training and Apprenticeship Program is funded through HRSA, and the CRSS Success is funded through the Illinois Department of Human Services, Division of Mental Health. The program is designed to support students with lived experience in mental health or substance use recovery to successfully complete the requirements to obtain their CRSS or their CPRS certification. So the CRSS is the Certified Recovery Support Specialist, and CPRS is the Certified Peer Recovery Specialist. We provide 2 semesters of instruction. Right now, those are online, and they're followed by either a 300-hour internship or a 2,000-hour apprenticeship. The CRSS Success provides a 300-hour internship. That's the state program. And they have a smaller hours, shorter hours, because the state is really wanting to get as many CRSS people out there in the community. And so it's pretty much a pilot project at this time. The students receive stipends, and we provide community health workers to assist them with wraparound services if those are needed. And the next slide is MAR Now. So this is a relatively new program. The MAR Now is funded by DHS, and it assists callers to the Illinois Helpline for opioids and other substances. The callers first speak with care managers who are out of Family Guidance Center, and they're directed to telemedicine providers who provide what are called bridge scripts for opioid use disorder or alcohol use disorder. If the callers are from Southern Illinois, they are referred to staff at our center, and the center staff then assists callers in providing or finding a local provider. And there are 2 other organizations who do the same as we do, and one is CARL and the other is Family Guidance Center. Next one. Okay, the Farm Family Resource Initiative is funded by congressional appropriations, and it was created to build a network of support and resources for Illinois farm families, and activities are listed here. So what the staff do is they identify family needs and look for available resources. They create new resources and provide telehealth counseling through SIU Medicine, Department of Psychiatry. And there is a 24/7 hotline for farm families in need of services. Next slide. So many of you are aware of the Illinois Catch On to Health Consortium, and it's a consortium in the Delta region. And to the right is their newest flyer created by our very own Ashley Moss that outlines some of the programs. There's the Coordinated Approach to Child Health, Character Strong, Signs of Suicide, Hidden in Plain Sight, and Youth Mental Health First Aid. Next slide. Okay, this is one of our newest programs that we are waiting for funding. So we were promised funding and we're just waiting for it. So the Mobile Medication Assisted Recovery Program. And this is a program to provides services for people dealing with substance use disorder in rural counties of Southern Illinois. So the state is putting a lot of money towards the mobile MAR programs, and they were wanting to pilot the program with us. It's a little complicated because we have to provide methadone to be a mobile MAR program. So there we've encountered some just issues with that. It's really difficult in rural communities to make that work. And so we're kind of leaning towards a mobile harm reduction unit at this point and working with the community action place to implement that. So these are some of the activities that are planned. And next slide, that might be it. And that's it. So does anyone have any questions? All right, thank you.
Sorry, I was unmuted there, or I was muted rather. Appreciate you being on, Kitty.
All right, no problem.
Can you talk a little bit about, do you guys pair any research activities around these types of programs, or are they strictly just kind of community-based programs to try and reduce health disparities and some of these things that you just mentioned?
They're mainly service programs, but we assist others who are doing research in this area. For example, DHS has provided funding to research, like we had other more like medication-assisted recovery programs that we implemented that are no longer in existence, but you know, to evaluate those programs. And we partner with the School of Medicine, Population Health, or Population Science, and they do a lot of research around opioid use disorder.
Great. Do we have any other questions for Kitty this morning? Again, we appreciate you being on.
Anytime.
Okay. Do we happen to have anyone from the Carbondale Warming Center on?
I texted with Carmelita. I'm going to try to send her all the call-in information so we can just keep going, and then she'll announce whenever she gets on or whenever you think it's good in the agenda.
Okay. So what we might do is jump to action team reports. So let me just pull that up here quickly. So Kitty, it looks like there might be some questions in the chat too, if you want to address those in the chat, or you can come off mute, it's up to you.
Okay. Sorry, I don't use WebEx a lot, and there seems to have been an update that's making me confused.
We've all been there.
So is the MAR hotline number available that I can share? And yes, there is a, if you Google Illinois helpline,
Okay.
you know, and I will put it in the chat.
Thank you very much, Kitty.
Are there any positions open? Yes, we have, not at this moment, but we will have positions open in the near future. So keep checking on the SIU School of Medicine website. If you just click in SIU School of Medicine employment, they will be listed there.
And if I could add just a little something to what Kitty was just saying about the positions, there's a blurred line between some of the work at the Institute for Rural Health and the Center for Rural Health. And the Institute we're going to start opening positions very soon. Similar programming, working across the center and the institute. Those positions will be on the SIU Carbondale website. So if you're looking for positions that might be center-ish, I would check both.
So the question, is there a way to find out who you refer to once you work with the individual? Could you elaborate on that question? Are you talking about in the MAR Now program? So how, I think I might answer this question. So when people are referred to MAR Now down here, we have two people working on this project. It's Brent Van Ham and Chris Massey, and they have a network of providers that they just started looking for people online in the very beginning. And so now they have a nice database of people who will accept those. To my knowledge, there is no follow-up from Family Guidance Center with the individuals. And again, it's a new program and just recently being piloted. I hope I answered it. Okay.
Well, great. Thank you very much, Kitty.
All right. Thank you.
So while we're waiting for possibly someone from the Warming Center to jump on, we're going to take a look at our action team reports. So we'll start off with Behavioral Health Action Team. So Ashley or Yvonne, any updates?
Yeah, this is Ashley. We are sending out our third of our fourth. So as you know, we were doing seasonally or quarterly self-care campaign for behavioral health providers. So we're working on our third one to put out there of the fourth. And then our next meeting would be this afternoon. So we do meet the third Thursday of the odd numbered months. Thank you.
Great. Thank you very much, Ashley. So built environment. So Angie or Molly?
Hi, this is Angie. Can you hear me?
Yes.
Awesome. Molly and I believe is also on the call, and I'll let her speak if she has anything she would like to add. We have not had a meeting. We're a little bit in transition with our action team with my change in roles at the health department. So be working with Molly to identify a new co-chair. I will mention about a meeting on February 6th that is coming up. It is the Jackson County Solid Waste and Recycling public meeting. So it's an opportunity for residents, those who live, work, and play in Jackson County, to provide input on issues related to waste and recycling within the county. And thanks everyone for your time with that, and I'll let Molly speak if she has anything to add.
Hi, this is Molly Maxwell. The only built environment updates I have, and we may have shared this at the last meeting, I don't quite remember, but the City of Carbondale has opened about 2 miles of new bike path, multi-use path, one of them being paved and the other is sort of a gravel surface. It's called the Mud Line, and it connects New Era Road and North Oakland Avenue. So that's pretty exciting, and we hope to begin construction on what's now being called the Saluki Greenway, which will connect Murfreesboro and Carbondale on the west side along Highway 13, and that's another multi-use path. So those are the updates I have for built environment.
Well, great. Thank you very much, Angie and Molly. I can attest they're definitely doing a lot of construction on Highway 13 because it's right next to my house. So they're working quite a lot.
Great.
All right, so Diabetes Today resource team, Debbie or Fanta?
Good morning. At this time, we don't have any updates, but other than Debbie and I have been getting together to try to figure out the plan for 2024. So we've got a few things in motion that we will be sharing with everyone soon. So our next meeting will be February 22nd via Microsoft Teams at 11:30 to 12:30. Thank you.
Great, thank you very much, Fanta. So Healthy Living, I saw Tony K put some information in the chat box. Is there anything that you want to expand on?
No, I just would, again, encourage people to participate in our Get Fit in the Frost Physical Activity Challenge. It kicked off January 1st, but there's only 25 activities that we ask that you complete. One of them is following our Facebook page. So if you'd like a copy of the challenge, it's a paper-based challenge. It's on our Facebook page.
She's like, oh my God.
We had a great meeting in January, and our next meeting is March the 4th. We meet at 1 o'clock, and you can participate in person at the Carbondale Park District office on Giant City Road or via Zoom.
Great, thank you very much, Tony K. I don't know if Nikki's on. If she is, do you have anything to add?
Yes, I'm on. I don't have anything to add, but I will drop the link to our Facebook page in the chat. So if everybody could give us a like, that would be awesome.
Great, thank you very much, Nikki. Healthy Senior Action Team. So do we have Becky or Robin on this morning?
Yes, this is Becky. So we ended up skipping our December meeting as it was just too close to the holidays for people. We are coming back today, actually, is our first meeting back, 3 o'clock. We're meeting at Rob's Pit Barbecue, which is right on the corner of 148 and 13. It's kind of our recruitment event. We're really looking to get more people to join the team because we want to do bigger and better events, but we really can't without more team members. So that's our goal for this month. We're also going to meet and discuss new events for the 2024 calendar year. We do have our date set for our caregiver retreat, which will be August 23rd. So we're really excited to get rolling with that and hopefully make that even bigger and better this year.
Great, thank you very much, Becky. So joint access to care, Fanta or Alicia?
I'm not sure if Alicia's on, but at this time we don't have any other updates besides save the date. If you're interested in joining our action team, please reach out to myself or Alicia and we will get the invite forwarded to you. Thank you.
Thank you, Fanta. So Positive Youth Development, as always, they have a lot going on. Sherry, do you have any specific updates that you want to talk about this morning?
Sure. So we just met this past Tuesday. We have discussed kind of what our year will look like as far as family vacation nights. So our next one that we have coming up will be February 8th, and that information is listed there. I do have a flyer if anybody would like to help promote. I also have a link to register as a vendor, or you can just register to be a volunteer. We are accepting people if they want to set up or tear down, so you don't even have to stay the whole time. And we do meet on the third Tuesday of each month at 1 o'clock by Zoom, so you can just contact me if you would like that meeting invite.
Great, thank you very much, Sherry. Public health, medical preparedness. I think I saw Jamie was on. Do you have any updates? Or Bart?
I am on here, sorry, trying to figure out all the updates. So there is an earthquake summit in March in Cape Girardeau. I'm going to post that link in the chat. This quarter's Spark Regional quarterly meeting was canceled due to inclement weather, but the next one is already scheduled for April the 16th at the Marion Pavilion at 1 p.m. is the general session. And Jackson County Ambulance Service is now offering CPR classes at their new headquarters. That can be for either individuals looking to obtain their CPR or groups. So if you know of anyone, you can have them reach out to the Jackson County Ambulance Service for more information.
Great, thank you very much, Jamie. Sexual health, do we have Lori or Philip on this morning?
Good morning.
Morning.
Yeah, since our last meeting together, since our last coalition meeting, we've had an opportunity to present sexual health presentations. Actually, these two were lectures on campus at SIU, one for the Master of Public Health class, and the second one for a Bachelor of Science Nursing class. And we really appreciate these partnerships because these are our emerging healthcare providers and healthcare staff and can be very effective in helping us advance the message of the importance of normalizing sexual health in order to increase our sexual health. We have a new partnership with Franklin Hospital Primary Care Clinics. We did a presentation for them and asked for their help in again providing more sexual health-based services within their clinic, with utilizing a sexual health survey, which is part of our presentation, and we give them handouts to begin those conversations, so that individuals who can't get here to Jackson County Health Department for our sexual health clinic can seek these services in their own community. We think that's paramount as we continue to serve the lower 19 counties. Let's see. The Sexual Health Action Team has a new Facebook page, and it's entitled, finally, the Sexual Health Action Team. And so it is live. I would encourage you all to take a peek at it. It is not as extensive as we hope that it will be in the coming months, because we're currently looking at available content, but we certainly would like the community's input, and certainly from the coalition, about events and topics and content that you all have, maybe in conversations with your own action teams, that would have some connection to sexual health, and especially any upcoming events. We would be glad to post those on our webpage. And lastly, our next meeting will be in person. It will be here at the Health Department on February the 14th. We do have a call-in option for that. And at the bottom of my report, I have the number for that in order to join our meeting if you're unable to be in person. And that's my report.
Great, thank you very much, Philip. Appreciate you being on this morning. And then lastly, we have the Southern Illinois Cancer Action Network. Do we have, well, I know Angie's on. Angie, any specific updates?
Yeah, so you have much of the information there. We did meet just on Tuesday. So we do have some a new representative from the American Cancer Society who has joined us for our region. And her name is Lisa Hinton. She is the Associate Director of State Partnerships. So she will be joining us. If others are interested, there's some other new initiatives coming around or happening within this team that were not listed there. We have the Illinois HPV Advisory Council, Those meetings are happening, and if anyone is interested, they can contact Lisa at lisa.hinton@cancer.org. We did have our guest speaker, Julia, from Washington University, and she's talked about the Safe Step study and toolkit, focusing on colorectal cancer prevention, screening, and early detection. So they have a toolkit that is available for clinic and clinic offices. They are also willing to do any training. If anyone is interested in more information about that, please reach out to her, and I'll put her contact information in the chat as well. That grant will be wrapping up. So if any new clinics are interested in having training for their staff on either basic information about colorectal cancer or how to increase screening among clinics, or help in looking at your processes or workflows, templates, sample text to patients, templates for providers, please reach out to her. And again, I'll put that information in the chat. Let's see what else. We did have updates from the 3 different cancer partnership meetings. So I know we have some of those members on, so they may share during the announcement time. Rudy Bess from the Illinois Cancer Ovarian Partnership is working to increase information distribution about signs and symptoms of ovarian cancer. So that group had their very first statewide meeting about 2 weeks ago. They have, through Southern 7, received a grant from Aetna to do some more work in that area. But if anyone is interested in becoming a part of that initiative to help around ovarian cancer, you can reach out to Rudy Best at Hope Light Foundation. And then a few, probably weeks ago, you may have gotten some information from Caitlin Keene from the American Cancer Society about the lung cancer screening or tobacco survey. And it also went out in the HSIDN update that's sent out every Friday. They haven't had much representation yet on that survey from Southern Illinois. So they're really looking for some more surveys from Southern Illinois. And just as a reminder, even if one person in your agency has completed it, that's great, but they really want as many residents from Southern Illinois to complete it as possible. So please continue to complete that survey. And then I think they are planning a walk for hope, if you want to put this on your calendar, with Southern 7 and Hope Light Foundation, and that will be Saturday, October the 5th. Please reach out if you'd be interested in joining our group.
Great, thank you very much, Angie. So I do want to be mindful. I believe Carmelita was able to join. We'll loop around back to other community updates. So Carmelita, can you hear us?
Yes, I can. Can you hear me?
Okay, we can hear you.
Good. Good. Hi, everybody. I'm Carmelita Cahill. I'm the Executive Director at the Carbondale Warming Center. We're excited to be here. Right now, thankfully to the city of Carbondale during this cold snap, we were able to open the upstairs up for this week to get people in out of these cold and detrimental weather conditions that we're having. The city has given us funding until tomorrow morning. I'm awaiting an email to see if we're going to extend that or not. Right now, of course, we're in the battle with COVID and all the nice communicable diseases that happen in a living shelter, from a runny nose to everything else. We're preparing that. Right now, we have 36 individuals downstairs, and we've had a solid 18 individuals upstairs, ranging from 18 to 23, depending on the night. It's been very critical. One of the good things we've been able to do with these folks is anybody that came in without an ID, usually we send them to the police department to get confirmed. And what's happening now is our mental health advocates are able to fill out the forms for them to get the ID at no cost to the DMV. So not only did a lot of these folks get housing this week, they also are getting some of that basic access to things that they need to function. So we're excited about that and being able to work with everybody to make that happen. We have some major events coming up. We have our second annual Coldest Night of the Year event. I will put a link in there for that. Right now, as of yesterday, we've raised the 5th most money in the United States out of them. And at this time last year, we didn't have any money raised. So we're really excited to bring this event back again for its second time around. I'll put a link to it if anybody wants to create a team, donate. And it's really about taking just this 5-mile little, less than 5K walk to walk in somebody else's shoes for that amount of time. We also have coming up in April 12th at the Newman Center, there will be a trivia night. The theme will be April showers. I don't have the link done for that. I'm creating that in GiveButter right now, but that will be out soon also. I know that'll be $20 per person or $150 for a team up to 8 people that you can have there. We're excited with that coming. Right now, for the food in our center, we are working with the Feed My Sheep volunteer group that creates that food, makes it. They've all gotten food handlers license over this past year due to some generous donations. I know Burke Electric was leading in that donation for that, and we're really excited about that because all of the people working in that now are food handlers, and they can go anywhere and make food for people, and that's a really exciting opportunity that we were able to get out there. And we had some guests take that class too that now have that license, so we're excited about that. As always, our needs are paper supplies, always, especially now, paper plates, cups, coffee cups, toilet paper, paper towels. Those things we go through a lot daily. If you figure if I have close to 60 people in here every meal, it's about 180 plates a day, not counting snacks and things like that. So it does get a little stressed with that. But we're looking pretty good. We're waiting to hear from the city to see what our next move is outside, according to the upstairs. I have faith that they are going to do the right thing, and we're working to see, what beds we can get people from upstairs and downstairs too. So we're working on that, and I will put a link to the Coldest Night of the Year page in the chat. And we also have a Coldest Night of the Year Facebook page. You put in Carbondale Coldest Night of the Year. There's a Facebook page to keep you updated too. Once you get on there, you might see that your church or your business already has a team and that you can join. So we're excited to see the community come out for that. Does anybody have any questions? All right, I pass this on to who it goes to. Thank you.
Thank you very much for being on this morning, Carmelita. We really appreciate it. We know how busy you are, especially in the last couple of weeks, and then it looks like maybe into next week, this weather is going to continue to be extremely cold. So thank you very much to your organization being on this morning.
Thank you for having us and for the support that all of the agencies here give us. We don't do this alone. So it's everybody as a group effort, and we're excited to be a part of it. Thank you.
Great. Oh, okay, so moving on to additional community reports, I do want to give Diana some time because she did reach out to me. I don't know if she's on this morning. Doesn't sound like it, but she had an event earlier this week. And I think they have they're calling it basically Carbondale at the Table, basically an open conversation about, I believe it's kind of the violence in the community and, opportunities to kind of solve that. But I think, obviously they had a meeting January 16th, I believe that was Tuesday of this week. But I think they have another one coming up. And I just don't have the date, but we'll get that soon. I believe it's on that QR code on the community report. So once that goes out, we'll try and get the updated date. Do we have any other just general community updates that anyone wants to share? You can either put those in the chat, which I'll include in the published report. Or if you want to come off mute, or just actually probably raise your hand and I'll call on folks here. So I saw Sherry first. So Sherry, if you want to go ahead.
Thanks, Matt. The next youth mental health first aid training that's coming up will be January 30th, and that's 8:30 to 2:30. You do have to pre-register for that training because there's a 2-hour self-paced online pre-work that has to be completed before you attend the in-person training. So I will add my email address to the chat and I can send you the flyer for registration.
Great, thank you very much, Sherry. So Bart, I saw your hand go up next.
Thank you, Matt. Here at Jackson County Health Department, we're continuing to administer flu and COVID vaccines, as well as the RSV vaccine. I did want to address a little bit of general confusion, I think, that's out there about the 3 RSV products that have come onto the market over the past 6 months. So Arexvy is a vaccine for those age 60 and older with certain medical conditions. Abrezvo is a vaccine for pregnant people during 32 through 36 weeks gestational age, and also for persons age 60 and older. And then Beyfortus is a monoclonal antibody for newborns and babies under 1 year of age born during or entering their first RSV season. So those are the 3 products. Locating them can sometimes be a challenge. Here at JCHD, we are carrying Arexvy, and so we're vaccinating those age 60 and older with certain medical conditions. We can also order Abrezvo on demand. So we have ordered a few of those and are administering those. And then we also have Beyfortus, which is the monoclonal antibody for newborns. We have some of that through the state Vaccines for Children program, but it's in very limited supply. And that's for those who are eligible, who are typically uninsured. And also, I just wanted to add in, we still have free colorectal cancer screening kits. Those are the FIT kits that you take home and use. So anybody in the age 45 to 75 range that would like a free test kit can stop by the health department and we will hook you up. And then those just come back here and we test those in-house. So that's all I have to add, Matt. Thank you.
Great, thank you very much, Bart. Sarah Miller, I saw you next.
Hi, thank you. It's Sarah Miller with Shawnee Health Service. The main update that I have is our Carbondale campus, which is off of Lewis Lane. We, a couple of years back, had purchased the nursing home that, I can't remember which direction it is. I think it's west, south, there we go, south of our medical facility. That we have finally been able to get completely demolished. So we have the space available. We're going to be beginning construction before too long on a new community health and wellness center. That facility is going to be focused primarily on services for the community, not actual like medical services. Those will remain in the other buildings on that campus. In addition to that, just want to let everyone know our case managers at all of our facilities are shift counselors to help with Medicare. And although the main Medicare open enrollment has ended, anybody that's on a Medicare Advantage plan has another open enrollment that runs through March 31st. So during that time, they can switch Medicare Advantage plans or cancel their Medicare Advantage plan and get back on plain Medicare. So that's all I've got.
Great, thank you very much. So Dale, do you want to come off mute?
Yeah, thanks for this interesting meeting this morning. I just like to mention a couple things that are coming up. on the 28th of February in the evening at the Civic Center in Carbondale, a like workshop sponsored by the Sierra Club, Faith and Place, in the city of Carbondale. We'll be having a workshop conference type of thing on healthy homes. Back in September of this past year, they had the first one, which focused on a broad number of issues, but it actually turned out that one of the big areas of interest was what can we do in our homes to make them more healthy? And this includes dealing with things like CO2 and other types of ventilation issues and mold and mildew and so on. So this will be in the evening on the 28th. Another thing which really relates to environmental issues, the First Christian Church in Carbondale on April 13th from 2 to 4, that's a Saturday, will be doing their second annual electric vehicle show. And so those of you interested in getting a chance to sit in an electric vehicle, please do so. And the last one I'll mention, which is probably the most significant event of the year, remember April 8th.
Mute button again. I didn't see any other updates, Dale. I appreciate it. So Angie raised her hand. Go ahead.
Just remind everybody about the resources page on the Healthy Southern Illinois Delta Network, with the coalition being part of that, of the HSID. And we as a group all continue to work to keep those resource lists up to date. So if anyone has updates to any of those lists, you can see on the bottom of the list the individuals' names who those updates need to be sent to. There are many people right now working on updating. I don't know if Cindy is on, but Cindy Johnson is working on the substance misuse updates right now and could use everyone's help. And then the Joint Access to Care team is really the team that helps to coordinate all of that. And then also on the 22nd, if any of you have not been able to attend and are interested, we are going to have what I think may be the final overall meeting of the discussion regarding the online community resource directory, directories that are out there, such as Find Help and Unite Us, to discuss what everyone thought of those, get feedback from those who saw the demos or have gone online to learn more about them. And then our goal is to really take all that feedback in the survey that was completed, and then kind of vote as a group. What do we think we want to move forward with? And then also develop a steering committee who will really be a work group to move that action forward. So depending on the which system that we choose, will be some fundraising aspects to be able to cover that. But the maybe long-term goal is to take all of these resource guides in Southern Illinois and put them onto an online searchable resource directory that maybe down the road can also be integrated into health records of either the health department or the FQHCs and other places. So those things can be sent out and patients can be referred more easily and community members can be referred more easily to those resources. So anyway, more to come on that. If anyone's interested, the meeting is January 22nd, and Lori Longville and myself are coordinating that meeting. And then, oh, one more other thing. Fanta did have to leave the meeting, but she does have some adult mental health first aid classes coming up in January, February, and March at SIU. So you can learn more about that on the HSID website.
Great, thank you, Angie. Tony K, I saw your hand up.
Yeah, I just wanted to mention, I did put in the chat that we will have the Healthier Choices Made Easy mobile teaching kitchen cart at the indoor farmers market this weekend at the University Mall from 10 to 1. We'll be making and tasting Three Sisters soup. So felt like soup was the right recipe. It has some squash, onions, garlic, and other fresh vegetables in it.
Great. Thank you, Tony K. Angie Keough, I saw your hand go up.
Yeah, thank you, Matt. Sorry about that. I just wanted to share a reminder about the holiday light collection that's going on. We have drop-off locations at Carbondale Public Library, Murfreesboro Youth and Rec Center, here at the Health Department, at the Sustainability Hub on the SIU campus, and then at the Recycling Center. And the collection goes in, until the end of January. So if you have non-like working holiday lights, please do bring them in.
Great, thank you very much, Angie. So this will be last call for any updates. So I do appreciate Kitty Jewel being on this morning, and also Carmelita being on, and everyone else. We do appreciate it. So next Friday, the 26th, our special meeting, that's going to be 10 a.m. to noon. Just a reminder, that's going to be at the SIH corporate health building, so not at the health department. So if you can make it, that's great. If not, please complete that survey regardless, if you haven't done so. And I think that's it for today. So thank you very much, everyone. Stay warm, and we'll see you either Friday or April 18th.
Thank you.
Thank you.